the last week of November, and every week health reporter Rose Beltz has joined us in studio to talk about different men's health issues. And today she's joining us with a specialist from Spokane Urology. Good morning, Rose.
Good morning, Jen. Thank you so much again for having me here in the morning show, and Dr. Massini from Spokane Urology. So testosterone, hot topic.
Yeah, thanks a lot for having me back to talk about another important issue for guys. You know, low testosterone and erectile dysfunction are difficult topics for guys to talk about with anyone, including their doctor, but I want to make sure that they know a little bit more about them so they know that there are treatment options. They're actually pretty straightforward problems to address and treat.
Well, and so real quick, if we could just briefly talk about the role of testosterone and why these levels are important.
Yeah, so testosterone is a natural hormone that supports the changes in men that we associate with being a man. So deeper voice, facial hair, like No Shave November, and increased muscle mass. Normal testosterone levels are needed to maintain muscle mass and support bone health, red blood cell counts, and men's sex drives as well.
So you had said as men get older. So when and why do they start noticing a change in their testosterone?
Well, testosterone normally changes with age. Starting in men's 40s, it starts to drop slowly over time, 1 to 2% a year. Now, there are other things that can cause that to drop faster or further, including medical problems such as particularly being overweight, and certain medications can do it as well. But guys over 50, if they look at in a big study, they looked at guys who were over 50, and over a third of them had lower than normal testosterone levels.
So that's interesting. So with kind of seeing these things creep up, is there a better way or a good way to diagnose this officially?
Yeah, when it's diagnosed, it's a blood test, and it's usually done in the morning, usually checked a couple of times because it can vary day to day, and we want to make sure we're not just catching one low value, that we actually make sure that it's actually always low so we don't over-treat. It should be, there's a couple other tests that are typically done after we've found low testosterone to make sure it's not due to an underlying hormonal disorder that could be fixed without needing to just put a guy on testosterone as well.
So with that, so what are some of the symptoms that would kind of warrant this kind of blood test?
Yeah, this is a really important point because we really shouldn't treat low testosterone unless it's causing symptoms. And the symptoms we typically see with it can be a little bit vague and caused by other things as well. So things like low energy, decreased libido or sex drive, and just kind of feeling crummy. I mean, just generally kind of malaise for guys. So it's important to make sure, that there's not something else causing those as well, and that it actually is low testosterone before we treat it.
So with that, is there a way to prevent it, and how would you treat it?
Yeah, so there's not really a way to maintain your testosterone level at the level it is in your 20s. And you wouldn't want to do that because it wouldn't be natural. That being said, there is evidence that losing weight and preventing obesity can help. Moderate regular exercise can help, as well as getting enough sleep on a normal basis can also help reduce the rate that that testosterone decreases, and can also reverse it in some cases. In terms of treatment, once we've confirmed that you have low testosterone, we usually treat it by giving you extra testosterone, and that's usually in the form of either gels that you apply to your skin, or patches, or injections, or implants that we put under the skin that release it slowly over time.
Gotcha. So I had noticed that sometimes people want to take things into their own hands. They jump to like a lot of these natural remedies. If we could just talk about that before we have to wrap it up. Yeah,
supplements are everywhere. With this, you can't go anywhere without seeing men's health supplements and boosting testosterone. They're probably not dangerous, but most of them also don't help. The ones that have been studied and most haven't really been studied don't show much effect on testosterone. And it's important to know what's in them too and talk about it with your doctor, because if you're taking something that interacts with one of your other medications, it could cause other health problems without giving you really much benefit if you are taking it for low testosterone.
Right, and it's like, I had read too, you take all these supplements, you think you're remedying one situation, you could be causing another situation. And another symptom that also, just a side effect real quickly, erectile dysfunction, that is a side effect that men want to treat.
Yeah, erectile dysfunction is actually even more common than low testosterone. About 2/3 of guys by age 70 will have some degree of low testosterone or erectile dysfunction issues. Important to know that it's treatable. I'm sure everyone's heard about Viagra, Levitra, Cialis, the pills you take. Viagra is now generic, so it's much cheaper than it used to be in the past. Beyond that, we as urologists see guys who the pills haven't worked for. So we talk about second-line therapies like vacuum therapy, injection therapy, and even surgical therapy where we put in an inflatable prosthesis in some cases as well.
You know, for sake of time, we're going to jump over to Facebook to continue this conversation. But I think it's interesting that low testosterone doesn't necessarily automatically lead to ED.
Great.
So we're going to talk more about
Absolutely.
that. So thank you, Dr. Mancini, for coming and getting up early. Thank you so much.
Thanks a lot.
You're welcome.
Appreciate
We'll be
it.
back with more Crime 2 Morning News after the break.